is it common practice for doctors to be asked to increase the revenue of the hospitals they work?
Right. So the short answer is yes. And there's again, it's an open secret. These are open secrets of Indian healthcare. But you see, I don't think, this is my experience working across 3, 4, 5 institutions of varying size over the last 20 years, including, of course, I have worked in the public sector simultaneously. So I have a sort of schizophrenic kind of existence. But so I don't think that every institution does it very overtly. I think what happens is that typically many doctors, many professionals feel that they're sort of duty bound to sort of participate in the revenue model of the hospital. So we've lost our sort of independence in that sense, autonomy in that sense, partly because doctors are paid significant amounts, partly because if you start questioning the revenue model, you could be sidelined. So there's a lot of discomfort. When I talk to my colleagues, they are uncomfortable about some of the, when they themselves see the bills, etc. But what has happened is that we've been co-opted into the system. We have no independent voice. You would be interested to know that India's private sector is huge now. The doctor working in the hospital has no union of theirs or no organization which can defend them. And therefore, if a doctor squeals...
The Indian Medical Association?
No, the Indian Medical Association really has no say in individual hospitals. Okay. And there have been examples of doctors who have tried to blow the whistle, brought out certain points, who have been summarily suspended overnight. So there is also a certain fear. And again, I come back to that what is all this doing? It is, it's not good for the patient. It's not good for our ordinary people who are trying to access healthcare. Yeah. So it's not good for transparency. And by the way, and there are hospitals who will tell you that actually there is space for reasonably ethical, reasonably professional, reasonably affordable healthcare to be provided. But if people are in a hurry and they make huge investments, and the investment returns model is sought to be sort of pushed through, it's again a slippery slope, and that's I think very peculiar to India, that you allow either individuals, there is individual doctors,
yes,
or
2 doctors
business,
in a family,
2 doctors, 5 doctors groups, or even business companies. Now pharma companies are coming up with hospitals. So you allow that kind of investment, which is actually a setup for perverse incentives. Because just think about this, a doctor is investing a large amount of money in a hospital. What will that doctor want? That on a day-to-day basis they want returns. Now how do you get returns? You maximize your profits. How do you maximize your profits? There are many such ways.
You keep someone in hospital longer than they need to be, you put someone in ICU when they don't need to be. So,
I think we have not been very clever, as in we are talking of our health state policy. The citizens of this country, indirectly have fed into a system which is ripe for exploitation and corruption.
So let me just break this down. You're saying that the concept of a doctor owning a hospital is fundamentally something that doesn't happen in the rest of the world. It's a model that only happens in India, and it creates a system where that doctor is now incentivized to drum up revenue rather than purely focus on treatment.
Yeah. So let's just understand how healthcare has evolved in the rest of the world. So a large part of the world has universal healthcare run by governments through taxes.
Yes.
There's no question of a doctor owning a hospital. It's all government led. Another section of the world where there could be private institutions, often linked to universities, but the funding is through insurance companies. And insurance companies, for good or bad, try to control the way the hospital spends money, how patients are charged, etc. India and South Asia also, but even in the South Asian scale, India is the country, the world, where the largest number of people pay out of pocket. Now that is sought to be changed, and I must say this, that we are seeing a trend in the last few years where more and more insurance, both state funded insurance, government led insurance or individual insurances coming up, but still it's largely out of pocket where individuals are paying. And that's a very peculiar system. Doctors owning hospitals, doctors investing huge. So I wrote about this many years back. The doctors as entrepreneurs, doctors owning chains of hospitals.
Yes.
It's right. It's inherently a conflict of interest situation. Doctors are scientists primarily. Primarily, doctors are caregivers. If they wanted to go into business and they could have chosen a different path, and they could dealing it. But the same person delivering care, the same person owning the hospital, the same person buying the drugs, the same person deciding bills, is a daily conflict of interest. And I think therefore somewhere along the way after independence, and that one is not able to locate the exact point, but slowly but surely we moved to this model, because we inherited healthcare from the British. The British have an NHS, the National Health System, and somewhere along the way we just went into another direction. There are many reasons for that, and people have tried to look at this. But now we have this gigantic or monstrous system where 80% of healthcare is delivered by the private sector with these kind of conflicts of interest. Now, you talked about COVID, and I think COVID was a wake-up call.
Yes.
Now, COVID hopefully is behind us, and it's all of us, heaved a sigh of relief, you and me sitting here without masks. But having said that, if we have not learned the lessons of COVID as a collective, I think it's very tragic.